I'll tell you, I'm a very medical person. I'm all about medicine, all about evidence-based, but I've been wowed by the impact social prescribing can have.
Social prescribing in Merton in 2018, for example, reduced GP appointments by 33% and also increased patients' well-being by 77%.
Health inequalities is massive. We know that 90% of health is impacted by social issues, and so we want to get people who are experts in this field dealing with those social issues, not medics who will medicalise it, unfortunately.
Social prescribing is really flexible. Because you have more time to kind of talk about those different issues with somebody, you're able to discover more about their life and more about what's going on for them.
Finding out that real story and that depth is often what some GPs actually want to know, but they just don't have the time to.
Somebody who can listen, who has time to listen, and somebody who understands when they do listen is vital.
For them, it feels like someone's really, really listening to them. And that's the important thing at the moment, is making sure that these people feel listened to.
The real gaps that the social prescribers have filled for us is they've fleshed out our view of what services work for which patients, and you start to get a sense for what might work for different people.
We also understand that sometimes there'll be things that are missing, that if we link with people and speak with people about that we might be able to fill those gaps.
We often forget primary care is part of community. It's often perceived as them and us, and actually, no, it should be sort of all joined up together.
We've basically taken the time to go around all the different communities, make ourselves known, speak to them. Just by having that kind of relationship with lots of different services means that we can bring that to the GPs.
The beauty about it is an umbrella. It's not just one thing. It can be linked to charity, it can be linked to gyms, it can be linked to general practitioners.
We're linking PCNs to the community, we're linking PCNs to social workers and to knowing what's going on and to knowing what other solutions there are.
I'm finding that Richmond has all sorts of services for old ladies like me, which is wonderful.
What the link worker does is a really, really powerful symbol, and also that integrated glue between primary care and the community.
We've been really lucky in Richmond because we've had a really brilliant relationship with the charity. We've used rules to recruit these people. We've had a lot of support from the local council, and I think having that integrated approach has helped.
The emails and the conferences and the knowledge that we're sharing, it's on a scale that we've never seen before.
All of us working together can't be a bad thing.
Sometimes the smallest thing can help someone, and just that link into their community and that extra support has just made all the difference.
During the pandemic, it was heartbreaking. Keeping people alive and keeping people happy and mentally well and physically well.
We have doubled our referrals due to the pandemic. It is still a lot of loneliness and isolation, but also financial advice, benefit advice.
Pandemic's here, and link workers have reacted wonderfully, and actually we've identified a bigger need now, more than I think than before.
The pandemic really kind of taught us what this role was and how important it is in the community. Something like this has never really been seen before, and I couldn't imagine a community without it now.
We've been able to find solutions for people and to give them options and help them feel less alone and less isolated during this time.
We had to work in partnership even more in relation to shielded patients, in relation to set up the community hub, and people are very grateful that extra pair of hands is available for the primary care networks and to help people and patients with a sort of person-centered approach.
And it certainly helped me, and it's opened up a whole new world for me.
And all I say to those who haven't tried it is have a go, you've got nothing to lose.
Social prescribing is going to be a win-win for everyone.
Get a link worker in for a year, see the impact, get to know them, see what they can do.
Social prescribing link workers, integrating with the community, getting patients the care that they need, and identifying what assets you live to empower your local community. So it can't go wrong.
I just hope that social prescribing is here to stay.
To be able to see the difference that social prescribing is making in people's life is amazing.